Afternoon. Good afternoon. I'm going to begin the meeting today and calling to order the Winnebago County Community Mental Health Board. Wednesday, May 6th, 2026 at 2 o'clock. Roll call first business. Mariana Body here. Greg Shaw. Dr. Copeland. Here. Dr. Giardini.
Here.
Dr. Gorski. Dick Kunert. Tim Neighbors. Here. Jeff Nielsen. Dr. Penny. Dr. Taylor. Mohammed Yunus. And we also, of course, have Jason Holcomb in the Region 1 Council staff. So we do not have any public comment today, nor do we have any presentation. So we'll move on to the monthly activity first before we begin. I'm going to introduce Dr. Colleen Taylor as our newest board member, and I'm going to let Colleen introduce herself and tell the board a little bit about you.
Afternoon. So my name is Dr. Colleen Taylor. I love to travel. I'm all about service, the community. Originally from Jamaica. I've been in the United States for many years. What else would be important to know? My education. And so I had my master's, and my undergrad from University of Wisconsin-Whitewater, my doctorate from Argosy University. I practice counseling in the states of Illinois, Arizona, Florida, Texas, and Alabama. I love what I do. Service is important to me. Anything else?
Glad to have you here.
Glad to be here. I'm all about service.
Well, you'll like this part then.
Moving on to our monthly activity report. Do you want?
Yep.
And again, I just want to emphasize that people listening and watching the meeting cannot hear unless we're speaking into the microphone. So that's why we only have 4 of them. So there's going to be effort in passing.
Thank you. Definitely, as you can see from the monthly activities report, a lot of site visits still being conducted. A lot were conducted in April though, so we're really narrowing that down. I think there's like 7-ish left. So if you haven't had a chance to go on one and you'd like to, let Alex know. I know she sends that updated list. We have at least a board member for each of the upcoming site visits that are scheduled, but there are a few spots open if anybody wants to join one, and certainly appreciate all the board members' participation because it really helps not only understanding the programs, but the relationships with the funded partners and kind of their understanding of the board's objectives and mission. The other kind of big thing was that we went to Miami and observed the Miami model and their workshop and facility that they have down there. We had 28 community stakeholders from Winnebago County attend. I can make the joke now that if one of the planes would have went down, we would have been in bad shape here in Winnebago County, but didn't feel like making that joke before we went. So. I think we got a lot of good feedback from the stakeholders that participated in that. I think everybody took at least one thing from it. And so that will be, I think, the challenge now is what are the priorities? What are the things that there's maybe some agreement around, or some energy around, a sense of urgency around, in discussing with some of the board members that attended, and also in coordination with Marianne, I've reached out to the consultancy group that leads that workshop to see what type of facilitation they might be able to provide beyond that. Not so much to do another plan. I think we do a lot of data collection and planning already, but more kind of facilitating priorities and looking at potential implementation opportunities. So we'll definitely keep you informed on that, and the timing will be good because we'll be heading into budget discussions in the next month or two anyway, so we can take a look at that. But I would anticipate anything that we're looking at would fall under direct procurement, which we're still significantly underspending on that for what we budget each year. So that's pretty much the big thing in terms of where we're at and the things that took place in April. As we're looking ahead in May, I forwarded all the board members a number of community event opportunities. May is mental health awareness month. And so there are a lot of mental health community events. You're welcome to attend those as I forward them, or as you want to as a community member. The one that I would really encourage you to attend if you're able to is the Building Budget event, because, and that's next Thursday. That event, in addition to it being really good and having a really good speaker, all of the mental health board funded programs attend that event with a booth to share their kind of resources and services with community members. And it's always been a really nice opportunity for board members to walk around and meet people from the programs that are doing the work, and very encourage you to attend if you're able to.
Thank you, Jason. Okay, moving on into our action items. First one being, I need a motion for the April 2026 meeting minutes. Terry, I need a second. Mohammed. Any corrections, any discussion? Hearing none. All those in favor, please say aye. Aye. Both same sign. Okay. The next action item is the resolution 2026X authorizing funded program budgets updates for program years 4 and 5. And actually, this resolution is in regards to the Rosecrans Access to Care Program, or project name. And basically, they're asking for personnel increase by $750,000 and increase the fringe benefits for the individuals by $135,000, and then decrease the contractual lines of revenue by $885,000. Should we vote on this as one resolution? I can give detail for the second, which is the Tommy Coral Memorial Foundation, the project name Family Community Mental Health First Aid Training. And for this particular request, they would like to have the direct supply line decreased by $10,320, and direct training and education increased by $7,200, and then contractual increase by $3,120. So basically, it's not an increase for either one, but we do need a motion for approval. Okay, Dr. Gorski. Tim? All right. This will take a roll call. Any discussion before? Okay. Andrell Bradshaw, Dr. Copeland, Dr. Giardini.
Yes.
Gorski, Dick Kunert, Tim Neighbors, Jeff Nielsen, Dr. Penny, Dr. Taylor, Mohammed Yunus, Mariana Body. Yes. Okay. And moving on to the second resolution, which is authorizing Winnebago County Community Mental Health Board to fund for mental health workforce student support. And I'm going to let Jason.
So a few things I'll say about this in terms of the background. When the Mental Health Board first started, we, in all of our kind of strategic planning, data analysis, and particularly in the attempts to do early program implementation through grants, found workforce to be a significant issue for the community. And then that becomes certainly a direct connection to the challenges associated with building new programs or bringing programs to scale or keeping staff in positions. Through the state association, ACMI actually advocated several legislative sessions ago for an update to the Community Mental Health Act on a couple of key issues. And one of those was on workforce, to just make sure it was explicitly clear. There was kind of some vague language around scholarships in there. It wasn't clear even what that meant. It meant different things to different people. And there was an update made to the Community Mental Health Act that clarified that mental health workforce support, including tuition reimbursement and a number of other specific things, could be funded. And so that was good timing for us as we had entered our Accelerator Award program, and the SWAT program was one of those programs that was funded to the development of a local bachelor's program in social work, as well as funding for master's degree programming and support for the kind of reinstitution of a human services program at a local community college. And all of that being coordinated into kind of a pipeline for social workers. As we looked at, so that funding, essentially the way that that program did that was supported recruitment and administrative support for building that programming, but then also used it for one cohort of students. And that cohort is completing their first year, and that funding will follow them. It's kind of earmarked for them for the remainder of their programming. As they had kind of informed the board in a public comment recently, the College of Medicine, they do not have additional student support funding beyond what students might otherwise find independently for additional cohorts. In alignment with kind of the mental health board's strategic plan, looking at the need for prescribing pathways, social work pathways, and peer support recovery, we kind of examined the local community need. Understanding social work pathways was one of those. On the peer recovery support specialist, the state is funding that significantly, and the institutions leading those programs do not feel that local funding would be any additional benefit at this time. But that the nursing or kind of prescribing pathways and social work pathways are still in need of support to recruit students to those programs and help them be successful, and then getting them reconnected to organizations in Winnebago County. So we looked at a couple of different models as opportunities, maybe provide a way to continue the momentum the board had already accelerated through the SWAT program, and came up with a model that would be a non-competitive funding model, but a criteria-based funding model that, based on a school meeting essentially existing in Winnebago County, being a public or nonprofit educational institution, having proof that these eligible programs exist and is in their academic catalog for the next year, that they would be able to enroll to receive a certain amount of funding for student support, tuition reimbursement, and wraparound support for students enrolled in those programs. So this would be for one academic year as a pilot. Also spent some significant time with legal reviewing through it, and a lot of from Brandy on that. And what you're seeing put forth today has gone through a full legal review as well. And I'm happy to answer any questions you might have on that.
Go ahead, Jim. The microphone.
Are the words demonstrated intent to stay strong enough to keep the student in?
I think that in identifying the possible models for that, beyond doing a reverse loan program where you're basically giving some type of loan and then you're forgiving a certain amount every year, or entering into a legal arrangement with a student directly whereby they owe me if they were not able to meet that satisfaction. There is not a stronger way to do it, I think, beyond those two mechanisms. And it is challenging to find, I guess, like a third party that would be willing to enforce those things directly with students. And then there also are some potential ethical implications of what that does for students. Also, what is even the point of it if a student could otherwise just get student loans and be under public student loan forgiveness or one of those student loan forgiveness programs. So I think that's why I'm saying pilot, and I know it will take time to see what that retention percentage is. But this is kind of at this point in time, I don't know if there's a stronger way to do it other than entering legal arrangements with. Yeah. Yeah.
And I assume that a relationship would be with us. I share a little bit of concern about that because it's hard to know what demonstrated intent to stay actually is. I mean, it's a little squishy, but maybe it's the best we can do right now. I'm a little with that. The other thing is help me understand, Jason, the term non-competitive. How is it non-competitive if there were enough applicants that you have $500,000 in your criterion base, but you have so much interest that the demand exceeds the funding capability?
I think at this moment in time, I don't think it would be possible for somebody to respond to this in a way that they created an academic institution in order to enroll in it within the period of time that we have. So I think we're probably limited to those institutions that already meet the criteria. If in the future we saw an actual response where new institutions were formed just to apply to this, then we could enter a competitive funding, but non-competitive doesn't require bird review and scoring and comparing one against the other and funding a limited number. It's just based on if you meet the criteria and you want to enroll, you can, but there's a cap on the total amount. So it's got to be divvied up between all the potential. I could be wrong about, there could be knowledge gaps in our assessment, but I don't foresee there being more than 3 or maybe 4 possible eligible institutions in Winnebago County at this moment in time.
Any other questions? Hey, this would take a motion for passing, so I need a motion. Okay. Who said second? Okay, yeah, thank you. All right. Roll call. Pardon me? Purple tab. Yeah. Purple cat, huh? There it is. I got one back here. Yeah, okay. Andrew Bradshaw. Dr. Copeland. Dr. Jardine. Dr. Gorski. Dick Honer. Tim Neighbors. Jeff Nielsen.
Yes.
This actually does not have any changes to it from the document we previously presented to you for discussion at the last board meeting. We did not get any additional feedback regarding it So we're putting this forward as it was previously discussed the last meeting, but essentially just a couple of updates based on things that we learned from the pilot year. We are seeing an expansion of organizations participating in this program, and we'll continue to monitor the budget on this, but essentially this is just the policy that each of the enrolled organizations have to follow.
And do we need a action item? Okay, very good.
Voice vote.
So we do need a motion though for passing. So we need a motion. Jeff, thank you. Second, Dr. Gursky. Okay. Any further discussion, questions? Hearing none. All those in favor, please say aye. Opposed, same sign. Okay, the final. Oh, we move on to our discussion items, and it's a strategic public participation survey and goal number 3, promotion and awareness. So Jason.
The podium here, and we're going to go through our third and final area of the strategic plan. And then just to remind you, the follow-up to that is essentially at the June meeting, we should have, barring any major changes that need to be made, we'll have a draft of the strategic plan for board review. And we will take any board member feedback on that, as well as that will lead to putting it out for public comment. And there'll be a public comment period for approximately 30 days, and then we will take that public comment into consideration as well, make any necessary changes, and then put that forward to the board for an approval. I think it will be ready for the August board meeting. So that's the process, but this is the third area, which is the promotion and awareness. And we did some additional data collection in this area as well. We do a public participation survey. The public participation survey we started with the second strategic plan. It was not part of the first one. So we do have some good change over time data comparisons. As you can see, in terms of the number of responses, we got a little different this time, where we didn't restrict a person completing it to only pick one perspective if they felt they had two perspectives. If, for example, somebody provides mental health services in Winnebago County and they also are the caregiver or family member that helps somebody with a mental illness navigate services, they could choose both of those, get different set of questions for each perspective, or they can just choose one of those perspectives that best fits and then answer that set of questions. So our total responses were 235 complete. Last time we had 258 complete and 100 partial. One good thing about the way we constructed it this time is we didn't have partials. We had all completions, so that was a good thing. And then we have the perspectives are, again, duplicated because they weren't mutually exclusive this time, and we have 305 perspectives essentially accounted for. When we do surveys in Winnebago County and we want a representative sample, usually our goal is to be at least 200, and 250 is pretty good. It's usually pretty representative statistically. So we feel that we were in a good range for this being representative of the community. First, we had the lived experience perspective, which can be an individual living with mental illness or substance use disorder, or a family member or caregiver, or somebody that identifies as both. In this case, the first question is regarding which services do you utilize we saw that service utilization went up as a percentage of the response in that category. So that could be indicative of more need or better connection to services. In particular, the psychiatric, kind of the clinical elements of mental health, which is psychiatric and counseling, was the highest percentage of services utilized at almost 70%. When we look at it broken down by perspective, we see a lot of balance there. So, we're seeing that caregivers and family members and people with lived experience are utilizing essentially in proportion the same services. Here's where we see what services people had a hard time connecting with that they needed but couldn't find. And one thing I'd like to highlight here is kind of a significant jump in finding information about services. Here we saw almost a doubling from about 15% to 30% of respondents saying that they needed information but had trouble finding information about services. So that's something we definitely want to pay attention to and unpack. I was surprised by that because we've done so much to put out additional information about services, and I think a lot of other community members have as well. We have been, I know United Way, Rock River Valley, public comment about their 211 services and how they're doing some community listening sessions around that. We have been in conversations with them about just being supportive and also wanting to hear what feedback they hear about how people in our community are having trouble navigating or finding information about the services they need, and hope maybe there might be an opportunity to be part of a solution for that. Just nothing I think stands out significantly. It's pretty balanced across perspective. One thing we do find generally is that there's a slightly higher proportion of caregivers and family members that find services hard to find than people who are living with mental illness. So I don't know if that seems to indicate maybe that, there could be a stress thing or perception thing. Just when you're that person helping someone else, it feels more challenging, or it could be that people that are utilizing the services directly have greater knowledges of the available services as well. When we ask, like, from your perspective, what would have helped you get the service you need but you couldn't get? One significant change I saw here, you see in comparison, most of the areas stayed about the same from last time, but one that jumped up significantly, more than doubling, was access to services in my area, like in my neighborhood or close to where I live. And that was an interesting jump as well, because we didn't see that as one of the highest areas last time. So I don't know if there's shifts in the way people expect to utilize services, or transportation barriers are becoming more significant. One thing that I would be hopeful for in this area is that our HIPAA compliant rideshare would support that connection to service and maybe see that number go down. And also with the grassroots funding, where there is a direct intention to connect mental health services to underserved communities through sometimes more neighborhood-based organizations or community-based organizations like a community center. That might be a way that some of this need gets addressed. But was certainly something to keep an eye on in terms of how that percentage moves over time. And then here, again, pretty balanced in terms of the different perspectives and the proportions for each area. This is the worker experience. You see, workers are less balanced in responses. It's more direct service staff and less administration. And that's probably, for this particular survey, what we want. The environmental scan survey does get a lot of administrator perspective already. So we like to see what the direct frontline staff perspective is. And here, the question is, what services do you perceive are easy for clients to access? And again, these surveys are interesting because sometimes they show differences in perspective. And from the perspective of frontline staff, finding information about services is actually the highest in terms of easiest, but then from people utilizing services, that was one of the higher challenges. So different perspective from kind of where you're at in the system. But the one that changed in a positive direction significantly was knowledge about crisis services and crisis response services. And I can only imagine that's a direct result of some of the crisis response services being funded by the Mental Health Board and the increased community awareness around those programs that we've seen over the past 3 years, particularly with the mobile integrated health and the crisis co-responder teams, which are increasingly well-known throughout the community. And even as we go on site, there are a lot of other organizations that are using those services in partnership and are very aware of them. This is less meaningful because it's already skewed in the responses. So you obviously see here that it's going to be the frontline staff that make up most of the responses in each area. When we ask, what do you think would increase access? Yeah, access or accessibility in my area is still one of the higher responses, and we did see significant change there. So another important note there that that's not just from the person using services or the family member, that's also from frontline staff saying that. But I also thought it was interesting that frontline staff also said more payment options. And that surprised me because we're seeing that more and more organizations are getting local grants, either the Mental Health Board or other philanthropy. So maybe something to find out more about, even through site visits or other opportunities to talk to organizations, to just kind of monitor, are there other funding sources that are becoming less available, or have there been federal changes under the new administration that have changed the way people are able to utilize Medicaid or other endowment programs? And then finally is the general community perspective. And here, a question that we asked last time that was the same was, what would you like to learn more about? So as we're just putting out general information that maybe goes beyond what's through an organization, what are the things that we want to be highlighting and promoting for community members? And the crisis services did go down here as well. So I think that continues to support that the information about crisis services has significantly improved. And that was the second highest response in the last iteration and is now has shifted down to the third. But then in general, just finding information about services in general remains a general community concern at over 35% of respondents making that their top concern in terms of what they'd like to know more about. We added a component of the general community member. Actually, this was for everyone, so sorry. For all respondents, we added something about awareness because this ties right to the strategic plan metrics. And we want to know, what is your general awareness with the Winnebago County Community Mental Health Board? Do you even know that exists? And we found that actually a majority, almost 2/3 majority, knew about the Winnebago County Mental Health Board. And furthermore, slight majority at about 51% said they've known about it for at least 3 years. Within the past year, about 1/3, and then a smaller portion learned about it just in the last year. So I think the board itself, its function in the community, seems to be reaching a good saturation point where more people are aware of it than not. And we did see that some of that awareness changed within last year, but majority did not. Majority hadn't about it for a longer period of time. But then lastly, we kind of want to make that connection. Okay, so you know about the board. Do you know about the programs that the board is funding? And here we saw a little less, a little bit of a less response where just a slight majority say no, just over 51% says no, I know about the board, but maybe I don't know about an actual program the board funds. Here, I think the perspectives are interesting because we see that with workers, whether they're frontline staff or admin, a stronger majority say, yes, I do know about programs the board funds, whereas some of the other perspectives, like lived experience in particular, it was actually a lower. So I guess one of the things we think about that is that might make sense because the workers are the ones that are more keenly aware of the source of the programs they're utilizing, and maybe those that are utilizing the service themselves don't always connect it with what funding source is providing that service. So something we definitely just want to be aware of and think about if that's important to make that additional connection to those with lived experience in terms of being able to understand the funding source for the services that they're using when they're utilizing mental health board program. And with that, I'm going to turn it over to Chelsea, and she's going to go through the strategies and objectives with you.
Okay. Next, okay. So promotion awareness is the last section of strategic plan. So promotion awareness. And as the board's vision is our hope for the community, we see a community where the residents are knowledgeable about mental health and have access to high quality mental health and substance use services when and where they need them. So that is built directly into the sub goal, or so the goal 3. So that vision is built right in. And then as you can see, well, in the past, it was part of the strategic, or the part of the community support system framework. So that outer circle. So access, promotion, and awareness. So the first one is access. So the only change, so you'll have those charts in front of you. The only change on the sub-goal section, hang on, I'm ahead of myself. Okay, sorry. The communications working group was formed in the goals of board vision, and we had a board member at the time on the group, and we had representatives from small and large organizations on that working group. So from that, there was essentially a collective decision and structure for what was essentially the direction for promotion awareness from the last strategic plan. So that was the old introduction. This is the new shorter introduction. So that group at this point in time has been kind of put on pause, but there still could be a referral group. They are essentially that feedback from that communications working group charter was what was codified in the actual strategic plan and communications working requirements in the funding agreements. So our new update on, hang on, the slides. There we go. So here are some updates from the last time I presented 3 years ago for the last time on this promotion. So we have increased all of our followers or subscribers on our main methods of communication. So the 56 plus on the MailChimp, there was some cleaned addresses for like people leaving organizations or people just unsubscribing because, you know, just not wanting. But so that number isn't as high as it was before, but it's still, we're continually getting subscribers each and every day. The YouTube went up 1, so we're over 100. Facebook went up 516, so we're over 1.2K. And then Instagram is up 64, so 250 followers on Instagram. There we go, now we're on access. So the update on there, the wording is the same, other than just up capitalizing funded programs. So the first objective, A, on the previous one, so the structure of these slides, the left side will be as before, and then the right side will be the update, which is on the version of the handout that is in front of you. So you'll see on the slide what it was in the past, and then the recommendation will be on the right side. So in the past, it was quarterly social media post. It will be once per reporting period based on what type of program you are. So if a grassroots, there are different reporting periods from the core programs. So quarter or quarterly reporting version. So we are making sure that 90% of the programs are successfully meeting that requirement. And so the first year of doing the forms was PY4. So that was the first year of actually having a formalized method of tracking this. So it was kind of just getting oriented to the form. That working group helped a lot with trying to make sure that the form was being used, getting feedback, and we updated it for PY5. And the process has been a lot more collectively better on both sides. And so when we're talking about a program doing at least one full score post, and the 3 categories to get a full score is you tag the board on the platform, which is Facebook or Instagram, mention the half-cent sales tax, and use the hashtag. Now you can do posts on other platforms like LinkedIn or other platforms, but that hashtag keeps everything cohesive no matter the platform. And that half-cent sales tax is mentioned and in the branding toolkit as required and encouraged by this board. And so those are the 3 categories. So a program getting at least 3 of 3, a full point score, is 97%, 89, and 97. So that program has at least 1 full score post. As you can see, there are more than the number of programs that have a full score post. Sometimes there might be specific restrictions why there might not be a full score, but the number of high score and posts has significantly increased this past year. So the old strategy B is just the mental health community event. So we want to have 90% of programs at the event and then over 300 at the event attendees, so community members. So I have actual metrics for that on the next slide. So the past 2 years, technically we've had every single program type that has been in attendance and having a table at the event. And the past 2 years, we have had over 300 attendees. Right now, we are currently over 400 for actual community members. And in addition to 100 like vendor type registrations. So as a flyer. The next strategy is the referral system in the community. This was actually originally with the communications working group, part of the comms working group charter. And the referral systems, and Jason also mentioned before with 211, just encouraging the utilization of that. Those systems have built up. So right now in the IRIS, which is under the Youth Mental Health System of Care, Rosecrans led, there are 20 of the 38 core programs, that's 52%. We will obviously be having additional grassroots programs, so we would like to keep over 50% utilization and to encourage the adoption and use of that and work through any red tape or hurdles that might be preventing it or discuss if it's appropriate or not. Not all type of programs would make sense to be an IRIS. There's also Gelada, which is the co-responder and MIH program. But then also there's that third one, which is 211, making sure information is up to date in that system. So then this will be the next section, which is awareness. So just focusing on the board's funding strategies is the update. So the first strategy is essentially now updated to maintaining a toolkit. So we've had 2 versions of the toolkit so far. And so there was version 4, and then it updated to 4 through 6, or yes, 4 through 6 version. Still an additional guide and referential documents to help support streamlined consumption or understanding of those documents. So that would be 90% of programs meeting those communication contract requirements. So then the other side would be the program's use of that toolkit. So obviously we'll be coming up to a refresh, looking for the 7 through 9, period of programming. And there's also been additional like grassroots amendments or, guidance of using those toolkit versions. So it would be 90% of programs meeting those requirements. So next one is kind of going towards handouts and web content of outcomes. And so the Engager One page has the funded programs information. So there are the rack cards that we have on the table that goes to that online platform. And then we also made an intention with anytime someone might be calling to our front desk here, that we are filling in those potential gaps, and we've updated things over time to make sure that people are getting to the information of intake on those pages, and then people can also have those impact videos that are on there. So it has what the programs are, the program description is, their impact videos, and any contact information or the way to enter a program. So that is really a big place that we're also in those communications forms, is a reminder to make sure that people check those and make sure they're up to date. Sometimes, staff changes or new information available, we make sure that those pages are up to date as much as possible so that people can navigate the place, know where the information that they can find to get to programs. So a great way to actually demonstrate that impact is the views of the page. So we have had so the goal is over 5,000 views. And you can see that the first 2 years we've had that. And so far on the first 4 through the end of the 4 months, we are at 2.5. So that big spike is when we officially launched the page. The home page is the most visited, followed by the co-responder page. And then we had that public participation survey. So that's third, and the last one is the MIH program. So finding on those pages has information about how to get connected with those 2 programs as well as all the other ones. The next one is to promote the programs through multiple funding or communications methods. So with all of the different back end of social media platforms being kind of volatile, changing over time, we're still looking at those metrics, but a stable metric to see that there's an increased awareness is increasing the follower number. So the goal will be from we're at 1.2 right now. We'll be going up to 3,000 on Facebook, and then Instagram will be reaching 300. Is a platform we're potentially looking at maybe doing a little more information on that page. So, but that would be the 2 goals for those 2 platforms. The next one is this one is eliminated. The recommendation is to eliminate this one. So is participate in community events. So in the kind of decentralizing approach is to have the programs in where their funding agreements is to do co-branded collateral, like handouts, programs, pamphlets, all that information. They're required to submit that at least 1 item every year. And so with the intent of having co-branded print materials, the programs themselves being at other community events, in essence, is then covering the fact that the board is present through co-branding. So in relation to that, so having 90% of programs submit those co-branded materials, but then the direct relation to measure is that 60% awareness of funded programs for that survey. So as Jason pointed out earlier, it was just under 50 on the no side. The goal is to get 60% yes of overall community awareness of a funded program. So then the last section is promotion, so just capitalization of the words funded programs. So the impact report is what we used to do and have those narrative stories. However, in internal evaluation, we determined that the ROI of those long form narratives and the trends of current media or information consumption of the general community or just, population, long form narrative is really not the best way to output information. So the direction is more to promote our dashboard. We actually are kind of the only one in this type of space to have a data dashboard of this kind. And we actually were given an honorable mention by the Grant Professionals Association 2 years ago about the fact that our data dashboard is so innovative for this industry. So our goal is to focus more in on that side of information. And then in there is skewed information depending on bigger events or, around the renewal. There was a lot more handouts being passed out. So a stable measure is data dashboard visits. So I have numbers from 2025 and then 2026 so far. Now you can see that I have outlined the finance subpage, and that will come into consideration for the next strategy, which technically we're eliminating, or the recommendation to eliminate, is that the annual report is something that's required by the community behavioral health community. Community mental health, I know that escaped me. So that is required. And so again, consumption of reading a thicker report. There is more of an interactive way to understand funding utilization by going to the data dashboard. And so then it shows where we're at in terms of the awards and spent amount. So instead of just a static report, obviously we still have to require to do the annual report, but the direction is to focus more in on the data dashboard metrics of that. So while this strategy is technically would be recommended to just eliminate, we are still capturing that information on the specific subsector of the finance and update board. So then the C is recording that impact presentation video. So we still would have the programs do that. And again, we have another situation of skewed data or kind of skewed metrics we would more focus on having programs do a post that would be a specific outcome, do their required posting, but we'd make sure that at least once in the program year, they'd have a post that specifically talks about outcomes. And so the playlist of the videos in the past, they dropped significantly. The first year was 1,700. Second time the videos were completed was 400. So as a more stable metric would be having a program making sure we're doing a specific outcome post type to capture that metric, and kind of more general population output of how information is consumed. So the programs are given different categories when they're submitting their comm forms. And the two categories that are available of the 5 are content about funded program successes and story about impacts in the community. If I am selecting for those 2 category types, in the past 3 quarters, there's been 18, 27, and 23 impact type posts. Now, that doesn't necessarily mean that that's one for each program, but programs are self-doing that already. And so we would just encourage them to make sure that they would do a post once a year that talks specifically about their impact. Like, we've served this many people in this quarter. A story about this person, was able to be stable, you get what I'm trying to say. So that would be the encouragement and recommendation for a post this time around. And then the last one, this has also been encouraged from the original communications working group about external promotion of their program. So making sure that the organization has awareness that they host a funded program. So they are required to do a stakeholder informing evidence, whatever that may mean for that organization, whether that be internal newsletter, a newsletter that goes to their board, a board presentation that talks about their impacts or present that video. Some people might have to present to, for the, they have to present at the county board meeting. So whatever that equates to best for their organization, they're required, and they've been doing that for the past 2 years, of proof of stakeholder informing items. So just keep encouraging that. And then it's just really been great. Actually, on one of the site visits, which was quantified, was that Crusader, their awareness of having behavioral health programs. They have one check-in if a client is coming in for different services, like say women's health, and like, you know what, I'm just very stressed out right now. They will then be, hey, the receptionist being aware that they have a funded program, be like, hey, let's get you connected to the behavioral health component of our work. So that's a direct impact of how this intent of this goal, which was specifically advocated by the programs themselves, to actually be in the contract requirements. So that is the structure of all of them. And so you can see here, this is what it looked like before. And then this would be the new version. So metrics that go specifically straight across. Some of them might have been duplicated, like that 90% of programs meeting communication requirements. So those are the strategies broken down. And with the underlines of the changes, with the measures, old, and measures, one more. Yeah. So that is my portion.
Questions? So. As it relates to the survey, as it relates to residents' awareness, is there any metric or any way we're capturing how they found out about the, particularly as it relates to the social media? Because I'm curious, okay, we're focusing on Facebook and Instagram, but if there's a certain population, at least generationally, that is more on TikTok or depending on the generation, I'm wondering, are we capturing how people right now are saying they're finding out about it online?
That was a consideration when we did the questions. And we really wanted to make sure that we captured some sort of metrics to base, because it was added to the end of the previous public participation survey. But everyone was given that resident awareness. But we wanted to make sure that we didn't want the survey to become too long and get good information. But yes, that was a consideration, and ultimately to just capture general numbers, it was determined to just keep it more simple. So yes.
It'll be a good thing to capture in
Yes.
some way.
Some way, just in general. But then the other thing is, it seems to me, it's not the content or information is not the issue. It's the modes, methods that we're getting it out. we got more than enough content because the data dashboard, as you said, is innovative. Nobody's even doing that. So I guess my question is there a way that we can, in addition to all of the social media things, because part of the issue with even the hashtag is we're trying to bump up the mental health. We're trying to bump up our hashtag in everybody's algorithm, if I'm understanding correctly. That's why we want them to post on a regular basis and so on and so forth. When you post something, make sure you get this hashtag. What I'm suggesting is that maybe there's some low-hanging fruit if we had some QR codes or something available in some culturally dense places so that it's so easy to access, it's just your phone type of thing. And the reason I say that is because I've been going to the Strong Schools events at various schools, and every time I go, parents are surprised or don't know about all the programs that are available for the mental health board. And if I had, I got some handouts or whatever, but if I had like a card, or if the school just had a QR code that's just available, that is just with all the stuff, then I can say, hey, just scan this QR code or something like that. I mean, I'm just using that as an example. But I think that in addition to everything we're doing with social media and the community events that we're going to, there's a way we can tap into some culturally dense city market places where there's thousands of people that are coming through, and just make it so accessible that you can't even get by it. You know what I mean? And then work is just doing the QR code to get it locked into our website or the data dashboard.
It's good feedback.
Website.
The website.
Of the funded programs page, it is over, so it's over 5,000 acre. And from there, it does lead back into our actual website. We do have methods that cross promote the different ways of information being available. So let me just, I don't want to overshoot.
Where they spend most of their time, which section?
The website itself, is kind of more of a official, like, disclosures and documents and funding resources for grantees. The one that's more public, that we promote for public because it's really about the programs that are being funded and how to access them and what they're about, is this page here, which is the funded program page. And it's through a platform that is specifically designed to be a public engagement platform. And on that page is basically the highest page. And the next highest page after that is the Crisis Co-Responder Program, which is actually one of the programs that people are clicking on to find out more information about. So we can see for all of the funded programs, which ones people are clicking on the most to learn more information about. And right now, that's crisis response services, which seems to also correlate with, on that survey, the increased awareness, knowledge about crisis response services. Probably not the only way people are finding out about it, but one of the ways. I don't think that we don't have like a click on there that automatically would say how easy is it. For the one that we're talking about here, it's through a national, actually international vendor that specializes in that. So they do user feedback groups to try to design it to be more user friendly, but we have not directly engaged any local user feedback about that.
I will say though, before we had this platform, it was just a long list that you scrolled. This has program cards, and it is also designed where it's mobile friendly. And it also has the languages of the different, the ones that were census-based information as well as other Region 1 advocated information. So we've added Swahili, we have Arabic. The survey was also available in all of those other languages. Those are available on there in the English and native alphabet of the language. It is mobile friendly. So I do think at least the iteration that we have now is a lot better than what it was prior to having this engagement platform that Region 1 has. Thank you.
Chelsea, a lot of great work here. Thank you for all the effort. Really appreciate it. You know, it's my perception that the funded programs are really pretty good with meeting their requirements based on site visits and when we see the proposals come through. But it's interesting that the goal setting for a lot of them is 90% achieve all of the requirements of communication. So I'm curious about the other 10%. So I know that staff
Yeah,
case scenario, not that it's ever happened, contractually, what if someone just repeatedly fails to meet requirements of communication? Excuse me.
so we expect 100%, but 100% is not the industry standard. When I have gone to conferences and talked to other funder groups that do this type of work, their compliance rates are lower and they think 90% is really good. So I was trying to use an industry standard benchmark, but we it's 100% and we have been achieving 100%. But to just keep the planning process with integrity of using industry standard benchmarks, that was something I recommended, was that we use 90% as that benchmark, but our internal expectations still be 100%, because I think our community partners are highly bought into this work and want to do the requirements and fulfill that. If someone were to not consistently not do that, obviously you see that information when we do the site visits on that report card. And while we have never, gotten to that point, the contracts do have a clause for, ending services by mental health board decision should there be compliance issues. There was an agency when we were doing the year-to-year annual, not multi-year funding, that became out of compliance and was not renewed for funding, but there has not been any that was ended during a contract year.
Part of the presentation, when you were showing the various areas that have been improved or the perception, what is legal advocacy and protection? Because even though it was like a small number over toward the end, it seemed that in the residents, in the workers, and in the whoever else was being measured, that seemed to be an issue, and I didn't know exactly what that is.
It's from the community system framework, and in terms of more practically what it is in our community, it would be like Prairie State Legal working with somebody that has a serious mental illness that's facing eviction and trying to help them maintain their housing, or somebody that's trying to navigate getting entitlements like Social Security disability and using advocacy or legal services as a means to support that. So this is a tighter timeline on this particular one because we are now drafting which means we have to get everything to the graphic designer to put together the document. So please, if you have feedback, if you could get it to us by the end of this week, that would be most helpful. If you really want to go deep into your thinking and spend your weekend contemplating, a recommendation. If you got it to us Monday morning, we'd still be able to incorporate it, but we're definitely on crunch time here. So thank you.
Here's your mic.
We have, as far as I'm concerned, there's no agenda item for other matters. So I will need a motion for adjournment. Mohammed, and a second. All those in favor, please say aye. Opposed, same sign.